Okay, hi everyone. Welcome back to my channel. I'm starting off this video with a clip from Monday morning. Mondays are always great because we don't start class till 1:30 p.m. We have the entire morning off. It's so nice. I usually go out on my balcony, enjoy the sun in Pasadena, breathe in that fresh air, and then I'll head off to the gym. Then I'll look through my planner. I write down everything that I need to do for the day and then cross them off, and this helps keep me organized. And then on Monday afternoons, I'll head into the classroom. This is an example of the biggest classroom on campus. It's on the first floor and there's lots of smart boards. All the walls, the speakers actually can project their slides onto the walls, which is really cool. And then it's walled off here. It's actually a lot bigger than this. Tuesdays are my OBGYN days, OB obstetrics and gyne for gynecology. And so these days I'm usually in clinic. And in clinic, I see patients on my own and then I present them to my preceptors and then we'll go back in the room together to talk to the patient. It's been really cool because OB is a really great combination of procedural and clinic. So not only do I get to talk to patients, but I'll get to help with measuring pregnant patients' bellies, I'll get to do ultrasounds, and I will even help with screening for bacteria like GBS. Other things I can do, pap smears, and I've even assisted with an endometrial biopsy in the past. So I usually take notes on that computer that you see there. So I really love this backpack and I'll have a coupon code linked down below. It's really sleek, very chic, and it's all black and very easy to clean. It has a ton of pockets. It has that Velcro area there that kind of attaches and I can put my stethoscope in, which is something I need every day, and so it's really easy to reach for. There's even a pocket on the side for my shoes. So the cool thing about OBGYN is that it's also a surgical specialty, meaning that we can head into labor and delivery and see babies being born and different procedures. I still remember the first vaginal delivery I've seen and the first C-section. I remember the parents being incredibly happy and it was such a beautiful experience. I honestly almost teared up and I think that's something I will remember forever. But my day usually begins with the locker room. The hospital provides scrubs for all the staff. Sometimes I'm in labor and delivery where the babies are born, but also sometimes I'm in triage, which is kind of like the emergency room for pregnant patients. Okay, so early Wednesday morning, I'm up and ready to go for family medicine and pediatrics. I've enjoyed family medicine a lot. This is my second year with my preceptor at this clinic, and no day is the same. Every day, patients come in of all different ages. I think the youngest patient I've ever seen in family med is 12 years old, and then the oldest was around 80, and everybody has something different. Some people come in with questions about their medications. Other people have stomach pain or ankle pain. It's so different and it keeps things exciting. One thing I love about clinic in particular is that the staff always goes all out in decorations. You can see all these beautiful festive decor for the holidays. It definitely boosts morale and it makes me feel happy when I enter. So after I see patients, I talk with my preceptor. We'll usually discuss if I need to improve on something or what things I did well, and then I will write notes. So we each have a computer given to us by the school, and we actually take notes or write notes in the electronic medical record system called Epic. And I have a special pouch in the back of the backpack for my computer, which is really convenient. After I see patients in the morning, I have pediatrics in the afternoon, so I'll usually head down to the student lounge. The student lounge is located in the basement, which kind of seems scary, but it's not. It's right next to the radiology suite, and it's such a nice room. I never knew that medical students could have their own lounge. I think that's definitely a perk. It's really nice to have a space where we all can just eat together, hang out, and relax between rotations. So in this lounge, you'll see that it's pretty clean. I think it's barely been used. We have lockers on the side with passwords or passcodes that we can enter. And there's 2 computer stations. These computer stations are awesome because they're basically monitors. We can hook them up to our computers, and they have a ton of stuff. There's headsets, bulletin board in the back, nice lamps, a phone, and we even get free printing, which is such an amazing bonus. Sometimes I would head down here to do presentations with my preceptor and the other student I'm with, which you'll see in a moment. But oftentimes I'll just come down here to eat lunch. There's a mini fridge and then even a microwave for us. And here's a clip of me and my classmate.
Hey, so me and Leandra just had family medicine together. Every Wednesday morning we're together here at Bellflower. Now we're on lunch break in the student lounge in the basement. And I have the afternoon off of peds. She'll be going to peds. But I decided to stay and hang out. And we're writing our notes together now.
Whenever I go to pediatrics, I always make sure to have stickers. A lot of the patients, they cry or they don't really want to be seen by the doctor, and stickers go a really long way, help them smile, and I've been enjoying my pediatrics experience. Okay, hi everyone. So I'm back from clinic. It's about 6:30 p.m. right now and I'm hungry, I'm ready to eat dinner, but I wanted to recap my day for you all. So then in pediatrics, we also see a wide variety of concerns and patients of all different ages. Today I saw an 18-month-old baby, and then I saw a teenager who was like 15. So it's really interesting in peds because for every age, there are different things that we ask them and different things that we do in physical exam. So for a baby, there's something called the fontanelle. It's kind of like an open space on top of the head, and we make sure that's open, but for like a teenager, we wouldn't do that. So that was my day, family medicine and peds, and then tomorrow I'm in class the whole day from 8:30 to 5:30. I'm not always going to the hospital for pediatrics, but I wanted to share my routine. I would wake up at 5 a.m., put on my trusty clogged shoes, scrubs, backpack, and then head out for the day. Pediatrics is most definitely the absolute cutest floor in the hospital. The walls are covered in paintings of birds and trees. I get to wear my unicorn badge holder, and it was a great experience. There were so many different concerns and cases that I saw. A lot of patients with fevers. There were some patients with neurological concerns, and we even got to go to the emergency room to do some consults. In pediatrics, we were on the wards, but we were also in the NICU and then the PICU. So both of those stand for the neonatal intensive care unit, and then the pediatrics intensive care unit. We also had downtime and we got to read articles about different diseases we had never encountered before, things we didn't necessarily learn in class. It was a pretty cool experience. Okay, we're in inpatient peds day 3, and this is my classmate Alexis.
Hi.
Where are we today?
We are in the NICU.
So we're gonna see a lot of babies. I hope it's really fun. So for lunch, we would eat in the cafeteria. Sometimes we'd be really lucky and they'd provide food. And then there was also a mall right near the hospital with a bunch of restaurants. So it was really fun. Okay, so we just finished our first morning session in the NICU. So Alexis,
Hi.
we got some free food at the cafeteria. And this is just the outside. After a long day at clinic or in the hospital, I'm way too lazy and too tired to cook something, so I've been relying on some frozen food. This is my go-to chicken wontons from Costco. So Costco, if you're watching this, please sponsor me. And I usually make my own dipping sauce with soy sauce, some sambal chili paste or regular chili, and then I'll add some sesame oil. One thing I've been noticing in medical school is that I need to meal prep or always have something to go in my freezer. It's been really helpful. So I know frozen food is not the best thing for my body all the time. I've been trying to eat a little bit healthier, always having a side of vegetables with my dinner, and then trying to work out too and finding time for the gym. But days like this, after clinic, I like to sit down with my dinner, enjoy my meal while watching Netflix. Something I've been loving right now is Grey's Anatomy. I think I'm on season 14. So if anyone watches Grey's Anatomy, let me know. It's full of relationship and drama, not much medicine, but that's what I love. It's really entertaining. There was also a Bath & Body Works sale nearby. Anytime there's a sale, I get excited as a medical student, and I used it as an opportunity to stock up on gifts and also lotions for myself, body sprays. I can't resist a good sale. Okay, Thursday morning, I'm back in school, and I always have some complimentary coffee. There's an ice machine I never even knew about until this year, and so I've been having iced coffee a lot. I also use a study room. This is actually a room used for interviews, I think. So if you get an interview at Kaiser and it's in person, it might be in one of these rooms. And then Friday is back to the hospital, and I'm in surgery for the entire day. So not gonna lie, surgery was super intimidating when I first started. Going into this year, I thought that I would pass out at the sight of blood, or I would get yelled at by the stereotypical surgeon and cry in the operating room. But honestly, surgery has been one of my favorite parts of this year. My day usually starts off by me changing into scrubs, and we wear safety glasses, we wear these lunch lady blue hats to keep our hair up, and then also these cute little booties to keep our shoes clean. This is the physician's lounge. It's usually a lot busier, but I'm here really early to film. And this is where lunch gets provided. So I never even knew this, but it's definitely a huge perk. Lunch is always provided on an operating room day. And these are the rooms where surgeons eat between cases and write their notes. This is a clip of me after surgery. Okay, everyone. So that is the end of my first day in inpatient surgery immersion week. It was such a packed day. I saw 4 lat choles, learned a lot, learned how to use a camera inside an abdomen, like someone's abdominal area, while the surgeon performed the procedure. I got to clip the cystic duct, which is this bile duct next to the gallbladder. We got to suture on the skin. I got to see a lot of cool stuff, and the surgeon sat down with me, explained anatomy, so I learned a whole bunch. And they gave us lunch today. It was some Mediterranean food. So all in all, very tiring but very good day. My Fridays always look a little bit different. Some days I'm in clinic for surgery. Other days I'm in psychiatric clinic. And then other days I'm actually at the psychiatric hospital in Los Angeles. This is an example of what it looks like there. I've interacted with patients with schizophrenia, depression, anxiety, and bipolar disorder. I've even sat in on a group therapy session, which was super meaningful, and I got to listen to a lot of patient stories. I hope you enjoyed this video. I'm currently on holiday break, so I'm going to take this time to relax and sleep. Thank you for watching. Please subscribe.